agreed on it, inherent. It's a right to have good health. It's a right to be safe, etc. This idea of looking seriously at the forces that are behind illness as violent forces. There's suffering in the middle of them. If someone is sick from a poor water system, that's a violent structure that's perhaps inescapable to someone who's caught in a situation where they can't change things. That violence is very real. It has very real consequences. It can be inflected through human rights intervention and language and rhetoric and innovation. But it also needs to be taken. But with that, it needs to be taken on as a central issue. And so that's been a huge orientation for me as I, kind of make my way through Haiti and through the work that comes for me to help work on. So that's the context. Partners in Health has come out of that. We're now in 7 countries in a big way and touching into 12 different countries in a variety of projects. But in Haiti, we have our largest project by far. There are currently 12 hospitals. 6 of those are really full functioning, 12 clinics, 6 are really full functional hospitals. We have over 5,000 employees. We'll see 2 million patients this year. It's a large healthcare network. And for me, very, very easy to brag about, to praise, because I don't do much at all. I come and go for a little bit of doctor work, a little bit of teaching, a lot of coordination around like the Right to Healthcare program that's part of the introduction, and I guess at this point the only title that I actually have is helping that project to bring people here. But Partners in Health in Haiti is a Haitian organization that was founded in this little spot. And has now grown. This is a very old picture, actually, but I couldn't find a more recent. I'll show you some pictures from a month ago in a second. And so this organization has grown to take on medical health, to provide clinics, to provide jobs, training, stabilization for the local talent and expertise that exists. Haiti has a good medical education system, a good nursing education system, and really what's needed are jobs and a way to keep those folks from leaving the country. Around that has always been work to, say, build houses, and I apologize, I don't have an after shot here, but this woman in the hat had tuberculosis, living in this small house with her family, husband and 2 kids. The 2 kids standing in front of her also were sick with TB. They were all exposed. Each was treated, they all did fine, but the real solution was to build them a house, which was done a few years after this picture was taken. And then this woman became a community health worker, and so now works to deliver care to her neighbors. And so that's a job. It's not a great job. It doesn't entirely change the situation of someone's life, but it's a backstop. It's a stabilization that I think has been very important to the 2,000 or so community health workers that we employ. Just a couple more medical pictures. Malaria is still a big problem in Haiti. This man newly succumbed to central nervous system malaria, and that's him going home. Vaccine-related diseases, just these very basic things. Again, all that needs to be done is to deliver vaccines to kids with tetanus or measles. Very fixable problems. But more difficult problems are also approachable. And so as Partners in Health has grown, and as we're taking on the model of doing everything we can for a patient, and doing everything we can within a context to prevent illness, cancer, for example, comes up. And we've had a growing cancer care system. And this woman here with this little lump on her neck is unfortunate. It's a lymph node from cervical cancer, the leading cancer killer of women in the world. Entirely preventable at this point with a vaccine, but certainly with proper screening and annual visits and pap tests and that kind of stuff. Still a very heavy problem for women around the world, including Chicago, where I've seen a number of women with fatal cervical cancer in the last couple of months, and none of them were wealthy. They were all poor folks who were not able to access care within Iowa City. And then this one had breast cancer. She's bald from chemotherapy. She had a mastectomy and chemotherapy, and she did great. So delivering high-tech care is also real possible, in addition to these very, very basic. I've already been saying this, but to me this is a really big point, and either from the medical point of view or from business or from partnership, really delivering and getting things done, to me seems like the most urgent thing, especially within the kind of tough context that we find ourselves in Haiti. Are there any thoughts, or we're going to have so much time, are there any thoughts or questions at this point?
I have one.
Yeah.
Regarding, you mentioned that the woman was able to heal from TB and is now serving as a community worker. What about the other populations, other indigent people that are employed? You know, you said there were 5,000 employees. Are many of them indigent?
Yeah, no, it's a good question. Yeah, all of them are Haitian. And really everybody's pretty poor. We do have a professional group that works with us, and nurses and pharmacists and folks like that, but they're actually not from these communities. They're usually from the capital or from some other part of the country. The community health workers are all local folks who've been trained and given jobs by Partners in Health. We've bragged over the years, and it's unfortunately still true, that PIH is the largest employer in central Haiti, and it's mostly these folks who are unable to access a cash economy. It's pretty rural. People exist on subsistence and a little bit of training. There are very few cash jobs, and so these community health jobs, which are part-time, they're just a few hours a day, pay something like $400 a year, which is not getting anybody terribly ahead, but it's keeping folks from falling behind, letting kids go to school. Yeah. So in actual fact, Partners in Health has employed really almost no one who costs as much as, say, I do. My job is as an academic. I see patients here and do that work to get paid, because in Haiti, a doctor makes less than I have to make to pay my debts and live in an expensive city and such. So we've put the focus that far onto employment that we actually don't employ people from outside unless it just can't be avoided. Yeah. Other thoughts? Yeah.
If extreme poverty were changed in Haiti, not severe poverty, but just extreme poverty were changed, that people were, I don't know, $2 a day instead of $1 a day, how would that change the work of Partners in Health? What difference would that make?
Oh, that's a great. Yeah, I can give you some opinion, from just time. Father Aristide has always said his hope in Haiti was to bring people to a level of decent poverty and out of indecent poverty, and respecting essentially that reality, to go from real desperation to something that's poor but potential. If Haiti would change just to that degree, which in numeric or dollar terms is not much, we could probably get out of the house building business. We could probably get out of agriculture, where people would be able to produce and export and create some economy locally. I think some of the illness stuff would stay about the same. Hopefully we'd see more things like diabetes and hypertension, and people ate better. We could get away from diarrhea and pneumonia and TB and get on to the next wave of problems like cancer, and that would be hopeful. And I'd only being partially flip. It's really hard when someone suffers or dies at age 25 or 30, when their life had so much more potential as a family person, as a contributor to the economy. I think things could stabilize pretty quickly. A lot of what we eat as produce, fresh produce in this country, especially bananas, come from the other side of the island. The Dominican Republic's a huge agricultural force, and Haiti could do that again. It would take some